And when they pass through, high pressure comes in, you slow your breathing down because there's more oxygen, and away goes the joint pain. So you're looking, if any of you have an observable alteration of your symptoms, especially joint pain, as the weather fronts move through, you're looking right at this pathology. Uric acid, very important scavenger of peroxynitrite. In the study of the chemistry panel of CFS patients, they have the lowest uric acid I have ever measured. For some reason, they don't have a defense, or at least this defense. HDL cholesterol, or basically the reduced cholesterol, is a defense against peroxynitrite. When the cholesterol binds peroxynitrite, it becomes oxidized. Quite frankly, cholesterol isn't a problem unless it's oxidized. That's increasingly being observed, that the critical number is not cholesterol, it's the oxidized cholesterol, and peroxynitrite oxidizes it. The less you're doing of this, the higher HDL will be, and that's an indicator of less oxidation. That's why HDL cholesterol is basically protective. Essential fatty acids are important in the defense of peroxynitrite. And then bioflavonoids are perhaps one of the most potent of all peroxynitrite scavengers. They're found basically in the skins of fruits and vegetables, and they defend the vegetable or fruit against photons that hit it, produce copious amounts of free radical production, and that is defended by the bioflavonoids present in the skins of fruits and vegetables, the most notable of which, of course, is the skin of wine. The skin of wine produces a very powerful bioflavonoid. And there's also the skin of pine trees, which produces pycnogenol. So some of these, the ginkgo is a bioflavonoid from the ginkgo tree. So some of our most powerful defenders lie in this area. So don't breathe fast. Where do you get uric acid from? You get it, interestingly, primarily from, well, you get it from protein. Actually, you get it from DNA, RNA, and DNA, which is concentrated primarily in meat. So meat you get a lot of uric acid from, and if you're not eating meat, you can eat your own meat. Right? People who don't eat or say fast eat what meat? They eat their muscles. Muscles, when you eat the muscles, you copiously produce uric acid. So meditate and breathe slow and fast occasionally. Good defenses against this. Eat wine, drink wine, eat fish, live a clean life. Almost sounds like the Bible. So that's why I believe this is right, because there's a basic human intelligence going on here, and there's things going on that's in our history, even in our religious traditions, and even before then, that have been handed down from person to person as to how you live in an oxygenated world. Now, nitric oxide is scavenged in the brain by B12. B12 is the primary scavenger of excess nitric oxide. According to Marty Paul, the reason that these people get better on B12 is that actually scavenging excess nitric oxide in the brain. Primary scavenger of nitric oxide in the blood is hemoglobin. If you derange hemoglobin by scavenging peroxynitrite, you deform it, causing a deformation of the red cell membrane. Has anyone ever seen deformed red cell membranes? L.O. Simpson. The deformation of the red cell membrane is precisely due to this. Deformed red cells, and also lowers the SED rate. Because deformed red cells is the cause of low SED rate. Found significantly numbers of CFS patients. Magnesium blocks calcium, which would protect against nitric oxide synthetase production. Blocking the NMDA receptor, which mediates this, would be helpful if you block. What drug blocks the NMDA receptor? The answer is magnesium. Good NMDA receptor blockade. The other way you can indirectly block the NMDA receptor is agonize the GABA receptor, and that's done with Klonopin and other GABA agonists. So some of the drugs we found the most useful in this disease, Klonopin and B12, actually have, this model predicts success with those drugs, and those drugs do work. One of my desert island choices would be magnesium, Klonopin, and B12, and it works right here. particularly if you are infected, emoting, or thinking, or smelling chemicals, especially that. Over here, superoxide can be partially mitigated by CoQ10 and lipoic acid, and then things that might mitigate or increase the action of SOD. Taurine is an SOD analog in effect. And what herb is an SOD inducer? Answer is hawthorn. A study in the Journal of the European Journal of Heart Failure showed that hawthorn at sufficient dose treated heart failure in a prospective multi-center trial. It's an SOD inducer. Mercury, of course, binds here. Mercury can be, I think, indirectly, but not particularly directly, chelated by EDTA. There are other mechanisms of mercury chelation. The problem with chelating mercury is you can mobilize it, and the stronger you chelate it, the more you mobilize it, and you're a mercury canary, so you're at significant risk if you take mercury out too quickly, I think. You can't move mercury quickly in someone that's a canary to it. So the more indirect and organic methods of chelation of mercury, I think, work better. Is there further evidence of mitochondrial dysfunction? In magnetic resonance spectroscopy, we conducted a study in collaboration with Columbia University in New York City, and we did a number of patients, 20 actually, and 70% had elevated lactate levels. And what that looks like is this. In interrogating small areas of the brain, particularly in the subcortex surrounding an area of the brain, the third ventricle primarily, or the lateral ventricles, which come into the third ventricle. In the walls of those ventricles lies the hypothalamus and related deep brain structures. And interrogation in these areas produce these large lactic acid peaks, and that is not normal. And a lactic acid peak of that magnitude has one and only one meaning in medicine. It means deficient mitochondrial function. That's what it means. So we can see by central nervous system interrogation, particularly in the areas around the hypothalamus and related structures, evidence of mitochondrial injury. And there it sits. What I've done in Asheville is I have collaborated with a group there and have done MRS scans with Asheville. And basically, I think of the last 10, 12 patients that we've done, only one was negative for this. Now, the problem with this kind of technology is that depending on where you look, and this next slide has that on it, but when I took my Macintosh and loaded in from the internet what I wanted to, it did work fine, but when we translated to a PC, I got this. So much for the Mac people having trouble with PC world people, but this didn't come out. But this is an advanced GE algorithm using the Sage 7 method at Stanford. They're able to show they can do multiple channel scans of the brain, and what they found is, depending on the frequency of how you scan for this, the lactic peak can be there or not there, or even reversed. So depending on how they set the parameters of the study, how hard they look, it can be there or not there. So I don't believe a negative unless I know exactly how they did it. The beauty about this particular technology, Sage 7 scanning, is it scans at multiple channels, so you can never miss the lactate peak.
Can you give that website?
It's the website. I got it from. You go basically to, you put into Google, I think, General Electric MRI scans, 3 Tesla coil, Stanford, and you eventually get to this particular site. We've done exercise ergometry for a decade or two, anyway, since 1991. It was required by the FDA in the Ampligen trials. We were required to do this. We had to do some preliminary studies to make sure we were doing it correctly. And we did a study of 25 controls, age and sex matched to 25 patients. You'll notice that the oxygen consumption, their ability to consume oxygen at maximum exercise is significantly down compared to normal groups. It turns out that the FIC method, the most, well, until recently, the best method for determining cardiac output, and the one published in Guyton, at least in its early stages, is the FIC method. Cardiac output in the FIC method is directly related to oxygen consumption, VO2. In this case, of course, they're looking at VO2 resting. This is VO2 max. So what you're seeing expressed in this diagram is exactly the indication that there's a cardiac output problem.